Protect and treatment from normal colds. Do you sneeze or your nose is filled and flowing? You may get cold. Antibiotics do not work against viruses that cause nausea. What is the common cold? The common diarrhea is a high respiratory illness that can be recovered in a short period of time. Symptoms of nausea colds usually rise within 2 to 3 days and may include sneeze, to close the nose, sore throat, cough, fever. Although most people with nausea does not have a fever. When the virus that causes colds first affects the nose flows. This mucus helps to wash the virus. After 2 or 3 days, the mucus can turn in white, yellow, or green. This is normal, and that does not mean that you need antibiotics. Some symptoms, especially flowing or filled nose and cough, can last for 10 to 14 days. These symptoms should improve over time. Symptoms can contain symptoms such as flu. It can be difficult or impossible to tell the difference between them only on the basis of symptoms. Nose flow is common symptoms of colds. More than 200 viruses can cause colds, but the rhinovirus is the most common type. The virus that causes colds can spread from one person to another through close personal contact. When to get medical care: difficulty in breathing, water loss, fever that lasts more than 4 days, symptoms that last more than 10 days without improvement, symptoms such as a fever or cough, which improves but then returning or getting worse. For any symbol that is severe, please meet the healthcare professional. When you have a cold, the mucus is filled in your nose and can cause dripping, headache, and sore throat. After the nose, there is no cure for colds. It will improve itself without antibiotics. If you have a cold, antibiotics will not help you improve. When antibiotics are not required, they will not help you, and their side effects can also cause harm. How to feel better: make a lot of rest. Drink a lot of juices. Use a clean humidifier. Use salted nose spray or drops. Use a rubber suction bulb to clean the mucus for young children. Breathe in steam with warm water or shower bowls. Use honey to remove cough of adults and children at least 1 year or older. Children under the age of 4, do not use cough and diarrhea in young children unless the doctor especially tells you. Cough and cold medicines can lead to serious and sometimes life-threatening side effects in young children. Prevention: you can help to avoid colds by trying to keep others healthy. And keep others healthy: clean your hands. Avoid close contact with people who have diarrhea or other upper respiratory infections. Cover your mouth and nose while coughing or sneezing. Avoid touching your eyes, nose, and mouth with no washed hands. Do not smoke and avoid second-hand smoke. When you are ill, stay home and keep the children away from school or daycare when they are sick. Suggesting and using antibiotics.